Hello, everyone. My name is Richard Knight. I'm the past president of the American Association of Kidney Patients. I am proud and pleased to be able to participate in this World Kidney Day 2024 webinar, one of two, on advancing equitable access to care and optional medication practices. Why are we here? I just want to re-emphasize the objectives that we're seeking to achieve. We want to increase education and awareness. Education is so critical with respect to the patient community. Education on therapeutic breakthroughs and barriers that we are facing worldwide in accessing care and treatments. Number two, we want to improve our understanding of the multi-level strategies while considering the differences across world regions that involve health policy, healthcare delivery, healthcare professionals, and of course, patients. And number three, which I'm going to focus on today, is increasing awareness of the necessity of equitable access to care for kidney patients to successfully advocate for tailored kidney health policies. Brief background on myself. I mentioned I was past president of the American Association of Kidney Patients, 17-year transplant recipient, lecturer at Bowie State University, and I want to point out that I am a member of ISN's Patient Liaison Advisory Group. And you can see I've been involved in several other activities that have me being involved from all aspects in the renal space, from diagnostics to innovation to transplantation. And one thing I want to point out, ISN's Patient Liaison Advisory Group reflects the structure of ISN itself. And we have patient representation from the 10 regions throughout the world. And the critical thing here is we're able to get together and discuss important topics and get input and look at things from a global perspective. So it's been very helpful and very enlightening to myself. And I want to thank ISN for arranging this group. And who are we? The American Association of Kidney Patients is the oldest and largest fully independent kidney patient organization in the United States. We also are growing in our international reach through our AAKP global initiative. And we represent the largest base of patient consumers, families, organ donors, and care partners in the kidney space. What do? We were founded in 1969 by 6 patients. AAKP has always been a patient-led organization. We educate patients and policymakers on the need for greater investments and innovations in kidney disease, research, detection, and treatment. We are known nationwide and more so throughout the globe for our aggressive advocacy on behalf of kidney patient consumers and their right to treatment care choice, of course, in consultation with the doctor that they choose to care for them. We define high quality kidney care as timely patient access without interference to innovations that help prevent and treat diseases and empower patients to remain healthy and independent and be able to pursue their aspirations, including meaningful work, full time or part time, owning a business, home ownership. And the importance of this is that early identification of this disease and access to the proper medication, we can slow the progression from having chronic kidney disease to going on dialysis by 10 or 15 years. It's important that patients have access to this quality care. So, what is equitable access? What does it mean? It means the right treatment at the right time for the right patient. A few barriers to equitable access. One, failure to align regulatory and payment decisions in a common sense manner that can delay timely patient access to new diagnostic devices or drugs. An example, in the United States, this situation is made worse by the federal government that allows for a Medicare Advantage program that market disadvantaged communities while simultaneously discriminating against highly vulnerable kidney patients by denying immediate access to medically advised kidney therapeutics. This can delay the therapeutics that can delay progression and help avoid the need for dialysis or kidney transplantation for years. Then there's the lack of consistent global health policies. Back in 2013, the World Health Organization launched an action plan. And since that time, that action plan has been implemented throughout the world, but 50% of the companies have not included chronic kidney disease in the implementation of the programs for the non-communicable diseases. So it's important that we get everyone engaged and having a consistent approach to implementation of this action plan. Government determinants of health. That is something that we look at where agencies, and again, depending upon the structure of your country, federal agencies either knowingly or unwillingly, they lose sight of their primary duty to safeguard vulnerable populations that they serve, including the kidney patients. And in many instances have migrated from the role of problem solver and instead have become a barrier to improve clinical outcomes and an exacerbator of health disparities. And I want to point out that these failures to exacerbate underlying disparities in patient outcomes and create additional burdens for patients related to employment, disability, and dependency. The time is now to address these failures. And now I'd like to talk about some things that we have done as an organization to address these failures. And I'm going to encourage you to get engaged and involved in organizations within your respective countries. And AAKP is a global organization, so you can feel free to participate with us. Launched in 2018 is AAKP's Kidney Voter. It's the first and largest kidney voter registration program in the kidney community. What it does is it's helped patients and their allies use both their voice and their vote to hold elected officials accountable for the decisions that they make with respect to kidney care issues. This is certainly a very active and favorite program that AAKP has implemented. It's called the AAKP Patient Voice, Patient Choice Program, where we mobilize those impacted by kidney disease and provide them with a platform where they can elevate their voice in policy and payment decisions that impact access to new diagnostic drugs and devices, and that can certainly improve and in many instances save their lives. It provides an interactive platform where patients and care partners can use to quickly identify current issues impacting care choice and treatment. Finally, its aim is to eliminate the unnecessary interference when artificial barriers or delays threaten patient access or threaten your right to patient consumer choice. So we invite you to join the fight by lending your voice in support to fellow patients who can benefit from greater access. Many ways you can do it. I want to provide you a couple of examples of how we're doing this within the United States through our organization. ISN is here. We have the Patient Liaison Advisory Group, which is playing a similar role in interacting with patient and patient groups throughout the different parts of the world. So we invite you to get involved. There are many reports. We know a lot of the problems and issues. Action is required. And as patients, we must get fully involved and engaged. These are the many ways in which you can access AAKP on social media. I want to thank you for allowing me to participate in this webinar. I appreciate the opportunity to share some insights, and I look forward to listening to my colleagues and continuing to learn how we can do something to help improve access to kidney care for all patients.